Where are we all going here? I mess this up every time.
There's a spot there.
I know, Jeff, right over here, Jeff.
You're right, Jeff.
Good afternoon and a very warm welcome to everyone. It's so nice to have you in Huntsville on this beautiful fall day. On behalf of all the residents of Huntsville, I offer a special welcome to Premier Ford, to the Deputy Premier and Minister of Health, Elliott, and to the President of Shoppers Drug Mart, Jeff Legere. Also joining us today are MPP Norm Miller, our MP Scott Aitchison, and the CEO of Muskoka Algonquin Healthcare, Natalie Bubella. It's a privilege to have the Premier in our community today for this very special announcement. And before I officially introduce him, I want to extend our sincere thanks, Premier, for your leadership and for all the hard work you and your ministers have provided for this last 6 months. Thank you for your commitment to the health and safety of Ontario residents through this pandemic. We as a community are committed to working with you and supporting all of your directives. And Premier, I know you are no stranger to Huntsville, the place you call your second home, and we're very proud of that. So it is my great pleasure today to introduce the Premier of Ontario, Doug Ford.
Thank you. Well, good afternoon, everyone, and it's great to be, as the Mayor said, my second home. I love the people in Huntsville and the area here, so you have to come up and pay us a visit one time. I love coming up here, especially this time of year when you see the leaves changing. It's absolutely beautiful, folks. I'm joined by our all-star health minister, Christine Elliott, and our local champion, MPP Norm Miller, also my parliamentary assistant. I also want to recognize Mayor Terziano. Thank you, Mayor, for your leadership and how hard you've been working. You're an absolute rock in this town. Thank you, Mayor, again. And I'd also like to welcome MP Scott Aitchison. Scott, former mayor, now you moved up to Ottawa, so I got to send you a few messages to tell our Prime Minister and our Deputy Prime Minister. And the CEO of Algonquin Healthcare, Natalie Bubella. And Natalie, thank you so much for all the work and your team over there. And of course, the President and CEO of Shoppers Drug Mart, Jeff Legere. And Jeff, you and your team are absolutely incredible. Jumping right in here, as we've seen the private sector do when we call out for help, everyone's jumping in, so I thank you. Partners like Shoppers Drug Mart, Rexall, and independent pharmacies have played a tremendous role throughout this pandemic. They have people like Dana who are making outstanding contributions to the health and well-being of their community. It's absolutely incredible. In fact, I want to thank all of the pharmacists and staff out there right across Ontario. You're all absolute champions. They've done a terrific job helping people over these past few months and making sure shelves are stocked and we can get the medicine we need. It's made a huge difference for our loved ones, for our seniors, and for those with disabilities. And we know that with the coming flu season and with the public health trends where they are, we will need to expand testing further. We need to make it easier to get a COVID test as it is for a flu shot. It's easy to get a flu shot. We have to make sure the COVID tests are just as easy. That's why I'm excited to share today. We will be expanding testing to pharmacies. Starting Friday, up to 60 pharmacies in Ontario will offer COVID-19 testing, including this pharmacy here in Huntsville. Here in Huntsville, this location will help take some pressure off the local assessment center, in addition to working with our partners to increase the number of testing locations. We're also working with our health partners to expand the options for tests. For example, there are less invasive tests like saliva tests. And I got to break into my speech here for a second. Health Canada, we need your help. I just can't stress it enough. All I'm hearing is crickets from Health Canada right now on the saliva test. These type of tests make it easier to test people, especially kids. And today, I'm thrilled to announce 3 hospitals in Ontario have agreed to offer the saliva testing option to patients. The one we heard about BC, and I want to thank the folks out in BC for coming up with this. These hospitals will include the Mount Sinai, Women's College, and UHN. And we're working to expand these options to even more hospitals, pharmacies, and other test sites. And we're continuing to press the federal government to expedite Health Canada approval point-of-care testing. Once approved, these tests will be game changers, allowing us to see test results in minutes rather than days. My friends, we're making steady progress. Like I said, we haven't taken a break this summer, and we aren't going to take a break. We've worked through June, July, August to ensure we needed everyone prepared and make sure that no one is caught unprepared. To ensure we have a top-notch plan informed by the best medical minds when it comes to preparing for a second wave of COVID-19. Tomorrow, we'll have more to say about our testing strategy, as well as preventing and managing outbreaks. This is all part of our comprehensive plan for the fall. My friends, this is a team effort. We're moving mountains. We are pioneering a lot of firsts. We are using every tool in our toolbox because we know what we're up against, and we won't be caught off guard. With an army of pharmacists, nurses, doctors, and all 14.5 million people in this province, we will be ready for the future. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you very much, Premier, and good afternoon, everyone. Our government has always maintained that nothing is more important than protecting the health and well-being of the people of this province. Since the start of this outbreak, we have taken decisive action to stop the spread of this deadly virus. Yesterday, our government announced the largest flu immunization campaign in our province's history, a critical part of our fall preparedness plan, which will help to protect Ontarians from future waves of the virus. Today, we are pleased to share with you that our government, in partnership with Shoppers Drug Mart, Rexall, and independent pharmacies, is expanding access to publicly funded COVID-19 testing in pharmacies. Beginning this Friday, up to 60 pharmacies will be providing testing for Ontarians with no COVID-19 symptoms. Individuals who do not have symptoms of COVID-19 will be able to visit these select pharmacies by appointment only for free testing. Pharmacies will pre-screen individuals in advance to ensure that they are not experiencing any COVID-19 symptoms before entering. Expanding testing to pharmacies is part of our plan to ensure that we are ready for future waves of COVID-19. With a recent increase in the number of cases, we are providing people with more options for testing to identify cases of COVID-19 early. Ladies and gentlemen, we must not let our guard down. Our best defense is still to follow all public health measures like practicing physical distancing, wearing face masks, frequent hand washing, and staying home when ill so that we can stop the spread of COVID-19. Thank you. And I'd now like to welcome to the podium the President of Shoppers Drug Mart, Jeff Leisure.
Thank you, Premier Ford, Minister Elliott, and our distinguished guests for being here today and for the confidence you continue to have in Ontario's pharmacists. My name is Jeff Legier, and I'm the President of Shoppers Drug Mart and a pharmacist myself. Pharmacists are among the most trusted healthcare professionals. We provide convenient community-level services and advice in nearly every city and town throughout the province. Over the past 6 months, our stores have remained open under the most unusual circumstances and have stepped up to support their neighbors and communities with their health and wellness needs. The Shoppers Drug Mart team provided colleagues to support Ontario Telehealth as they attempted to manage the incredible spike in calls over the first few months. Our stores provided free home delivery of medication to our patients who were unable to come in, and our company worked to make healthcare more accessible to Canadians with online access to mental health tools to manage stress and anxiety, and through a partnership with Maple providing virtual care. Some of you may be aware, about 3 months ago, we were proud to partner with Alberta on a similar program where we expanded testing to people without symptoms. We started slowly, but today have more than 230 pharmacies involved. We've done close to 67,000 tests in that time, with really great feedback from patients, and it's proven to be safe and effective. We know that there are people who need tests done to go back to work, to travel, or to visit with family and friends. Expanding testing for asymptomatic individuals into pharmacies is a convenient, safe, and reliable way to increase accessibility. We're happy to do more to be part of the solution. As I turn the podium over to Natalie Bubella, CEO, Muskoka Algonquin Healthcare, I want to say thank you again to the Premier and Minister Elliott for your hard work bringing this initiative forward and allowing pharmacies to help our communities stop the spread of COVID. And thanks also to Dana Murdy, who's our associate owner in this location, and her team for really stepping up. Thank you.
Thank you, Jeff. Greater access to COVID-19 testing through expanded options for a COVID swab is great news for any community. We welcome more alternatives for testing that provide additional options for the COVID-19 assessment centers currently available in Huntsville and Bracebridge. Muskoka Algonquin Healthcare has been running an assessment center in Bracebridge for nearly a month. We continue to evaluate the operation and do our best with the resources we have to operate our by-appointment center Monday through Friday, 9 a.m. to 5 p.m. For months, our teams have been on the front lines of the pandemic across our 2 hospital sites, putting their best foot forward each and every day, making safe, high-quality patient care their priority. We are continually enhancing our pandemic response at the hospitals as we prepare for what may come this fall and winter. Especially during a pandemic, it takes a village. The more that community healthcare providers are able to work together to support local healthcare and COVID-19 testing needs, the better our communities will be. I'd like to now invite to the podium the Member of Parliament for Parry Sound Muskoka, Scott Aitchison.
Well, thank you very much. It's always a pleasure to welcome the Premier and Minister Elliott to Huntsville and Parry Sound Muskoka. I just want to say thank you again to the Premier and to the Minister of Health because, of course, we didn't have a active testing site here in Huntsville specifically, and I called the Premier, and he's got to be the most responsive Premier I think we've ever had in this country. And he told me that they would have a solution, and sure enough, they've come up with one, and I think it's a brilliant one. So thank you very much, Premier. Thank you to Minister Elliott for all the hard work you're doing. And know that as a Conservative Member of Parliament, we will continue to advocate on behalf of the people of Ontario and certainly all of Canada to make sure that our federal government is working with the provinces. I know there's been a request by the provinces for some more healthcare dollars. I hope to see some of that information in the throne speech this afternoon. We'll continue to advocate for you under the stellar leadership of our new leader, Aaron O'Toole. So thank you again for being here, Premier, and Minister Elliott. Looking forward to seeing this operation up and running and protecting the health of people from Huntsville and all around the area. Thanks.
Good job, Scott.
Well, thank you, Scott. I really appreciate you coming all the way down to join us today. And thank you to the Premier, Minister Elliott, and shoppers for this amazing news. This additional testing location is going to make a real difference in our community. I would also like to recognize Mayor Terziano and Ms. Bobella for their leadership through this pandemic. It's innovative solutions like the ones we've announced today that will help us remain prepared in the fight against COVID-19, both in our community and in communities across the province. So thank you to everyone very much for coming, and please stay tuned for more of our government's COVID-19 fall preparedness plan in the coming days. Thank you.
That's great.
We'll go to the phone line for questions. Just a reminder that it's one question and one follow-up.
Your first question comes from Colin Tonello with CTV. Please go ahead.
Hi there. Good afternoon, Premier.
Hi, Colin.
Does the government have any hard data or even an estimate as a percentage of people who are being turned away from assessment centers on a daily basis?
Well, what we're looking at right now, Colin, we've tested, as I said, more people than all of Canada combined, and we're well over 3.5 million tests, and this is where we're ramping up. I want to again thank, and Jeff is his team, and Dana here, in Huntsville for opening up their store. We're going to ramp this up right across the province with pharmacies to take the load off the public system. I see it, Colin, when I drive by. You know, everyone's getting tested. I fully understand that. I just want to emphasize for any of the pharmacies, including shoppers here, if you're asymptomatic, if you feel you've been around someone with COVID, come and get tested. But if you're showing severe symptoms, do not come. I repeat, do not come to a pharmacist. Go to the local testing areas. So I understand what you're saying, Colin, but we're going to ramp this up and take the load off the public system that we've seen over the last 10 days, 2 weeks.
Follow-up?
Okay, but Premier, people are being turned away from testing centers on a daily basis because those lineups are so long. So I'm just curious, do we have an accurate picture of community spread right now in Ontario, considering the fact that we have a large processing backlog and there are so many people being turned away? Do we actually have an accurate picture of how far and wide this is spreading right now?
Well, Colin, as you know, and you don't have a crystal ball, neither do I, what the numbers are going to be a week down the road or 2 weeks down the road, and we're prepared. We're ramping up the testing more than anywhere in Canada. We're showing the results, and we're going to continue ramping it up. And I'll pass the balance over to the minister. Thank you.
We are preparing for the worst. We had several scenarios modeled for us earlier on that indicated that we might be doing just a slow burn with some small peaks and valleys, or they might be larger peaks and valleys, or I think for the worst case scenario, there could be a sharp spike in cases across the province. So we're following that on a daily basis, and we have prepared for the worst. That will be contained in the further details of our fall preparedness plan about how we build capacity quickly, how we deal with outbreaks in different communities, whether it be in congregate care settings like long-term care homes or whether it's in communities geographically. We are prepared for the worst, and our fall plan reflects that. This is another key element in our fall plan, building access capacity to access for testing. And so we're very, very fortunate that Shoppers Drug Mart, Rexall, and the independent pharmacies have stepped up. We're very grateful for that because it will make a significant difference for us in being able to increase our testing volumes and people not having to stand in hours for lines to have a test.
Next question.
Oh, okay.
Your next question comes from Sarah Law with Metro Land Media. Please go ahead.
Hi, Sarah.
Good afternoon, Mr. Premier. As of today at 10:30 this morning, there have been 180 school-related COVID cases in Ontario, and in Huntsville, we had our first school-related case confirmed last night. So as social gathering limits have become 10 indoors and 25 people outdoors, will the province be considering shutting schools down at this time?
Well, what I can say is everything's on the table, but I can also tell you the system's working. We had a few schools with the outbreaks. We had to shut down 2 schools, and then there was 3 other outbreaks, and that's the last I've been advised. But you can tell the plan that we've put forward is working. We're making sure that we have the kids that have any cases, that they're isolated, the cohorts, depending if it's the whole school or cohort, we'll move the cohort out of the schools. But again, because of the great work the Minister of Education has done, along with the principals and the teachers and the boards of educations, the system's working. And to put it into perspective, we have over 2 million students, 4,800 schools, and do I wish there was no closures? Absolutely do I wish. But is the system working? Absolutely, the system is working.
Follow-up?
Yes, so with COVID cases on the rise in the province, at what point will the decision be made as to whether or not we have to return to lockdown and tighten the restrictions we have in place?
Yeah, good question. We'll be relying on the Chief Medical Officer of Health and the health table, and we'll make that decision if we see this escalate any further. But again, everything's on the table. I won't hesitate. I was the first premier in the entire country to shut the schools down before, and I won't hesitate to shut them down again if we see this continue throughout all the schools.
Next question.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Hi, everybody.
Hi,
I
Jeff.
wanted to ask about if we have any projection or idea about whether the drugstores that we're going to now allow to test asymptomatic people, how much of a dent that will make in the lineups. If we have a number on how many a day we're expecting, and if the number in Alberta was 67,000 in total, that's a good day and a half of tests in Ontario. So do you have a projection on, are we looking at 1,000 tests or 10,000 tests? What's the number that we'll be able to do at Shoppers and other drugstores?
Well, we're going to be monitoring it, and that's why we've rolled out a little over 60 right now. We're going to ramp that up right across the province. We'll be able to get a better handle as we see the tests come through at this location or any other location. I think it's going to put a big dent. But what's even more important, Jeff, and the reason there's lineups, very simply, Health Canada, we've been waiting for months for these antigen tests, the saliva test. And, something, God bless them. They work hard, but they need to start moving on this. This is what's affecting the whole system. Nothing is more important to the people of Ontario right now than getting Health Canada to approve the test. And as I said in my speech, I'm up here and I'm talking to the deputy. And by the way, Deputy Prime Minister is doing great. She's talking to him as well. But I'm hearing crickets. I'm hearing nothing, silence. How do you expect us to plan when one of the major tests are the saliva test or antigen test? We'll take anything. We've taken some of the tests from BC. We're putting it in the 3 hospitals I mentioned. But I'll tell you, the new CEO, let's get it going. Let's start moving, start pushing. Health Canada, nothing in this country is more important than these tests right now. Because what it's doing, it's affecting the whole system. Just imagine if we had these saliva tests, like I've been on here for a couple months, begging and pleading for Health Canada to get this done, we wouldn't be in this position right now. It's very simply, we'd have these stores up and going. We'd have additional sites. We'd be able to test more people. But we have the nasal test per se, and that's a lot tougher than the saliva test. So I don't know how many times I got to do cartwheels up here and scream out to Health Canada to just start approving these tests. You've had enough time, and it's just not happening. So it's frustrating to say the least.
Follow-up?
Sure. And just to follow up on that, Premier, with 2 mini questions and 1 question. One, about there are concerns about the accuracy of those tests, the antigen tests that Dr. Allen was just talking to me about the other day.
Sure.
I wonder if you could address whether that's an issue for you. And then 2, is there any discussion of, given the testing situation, if it doesn't get better, of looking at maybe not testing asymptomatic people at all anymore?
Well, they're good, two great questions, and what I'll do is I'll pass this over to the minister. But thanks for the questions.
Well, we certainly want to continue providing the tests to anyone who needs them. That's what we've been advised by the Chief Medical Officer of Health and the Health Measures Table. They re-examine these decisions from time to time, and that's what they're currently recommending. So that is one of the reasons why we have moved forward, and the pharmacies are assisting us with that. With respect to some of the other tests that we're looking at, we know that in the areas where they're going to be offering saliva testing, for example, they're going to run that along with the nasal pharyngeal tests to determine their effectiveness and to make sure that they are reliable with their results. So we are running that as a test project to make sure that we can count on those saliva tests, which would be, as the Premier indicated, very, very helpful for us, particularly when testing children. It takes several times as long to do a nasal pharyngeal test with a child than a saliva test, because they don't want something stuck up their nose. So we need to make sure that we can have the easiest possible type of testing to be able to do, particularly with children, because many of the parents are concerned because their children are back in school and want them to be tested to ensure that they remain healthy.
Next question.
Your next question comes from Wendy Gray with Vista Radio. Please go ahead.
Hi, Wendy.
Thank you, Premier, for taking my question. Good to see you in Muskoka.
It's always good to be up here.
Area.
Absolutely. Thank you.
As my colleagues from Metroland said, Muskoka saw its first case of COVID-19 in a school in Huntsville yesterday. The number of cases in schools is showing signs of growing outside of the troublesome areas of Ottawa and Toronto. So is the government still not willing to consider smaller class sizes?
Well, again, we have the smallest class sizes in the entire country, bar none. We have now up to 625 nurses spread out across the province, and we've given $170 million to hire more teachers if they want to reduce the class sizes. So it's up to each individual board to make that decision. They have the financial resources. It's going to be up to the boards, be it the board up in Muskoka or any board across the province, to reduce the size of the class. The money's there to hire new teachers, and it will always be there. So that's going to be up to them. But I just want to remind everyone that in the hot spots, be it the Peel or Toronto and Ottawa, that the sizes of the classes are capped for especially the lower grades up to 15 kids. So we're going to do whatever we can to make sure we continue to give the tools and the resources to these schools, the school boards, to reduce the class sizes if they wish to do that, if they feel there's a spike. And they know they can do that. And we'll be there to support them.
Follow-up?
Is the province starting to see a decline in the number of students attending in-person learning because of cases in schools? Are we starting to see parents particularly pulling kids out of in-class learning?
Well, Wendy, right now, there has been a decline. It's not the full 2 million students. And some people are anxious, and I fully understand. As a parent myself with 4 girls, they're out of the school system, but I understand if they want to hold them back and do at-home learning. That's fine. I encourage that if they want to do that. So we're going to support them. We have a great program for at-home learning, and we have the safest classrooms anywhere in the country with all the protocols that we've put in place. No matter if it's hiring more teachers or the nurses or hiring 1,300 more custodian cleaners to clean, we're pulling out all the stops to make sure we have a safe environment for the kids. And keep in mind, the larger the community spread, the more of a chance it's going to get into the schools, get into possibly long-term care. So that's why I'm always up here preaching to make sure you social distance and you wear your face masks and just practice the protocols. It's absolutely critical that we do that right now, at all times, actually.
Next question.
Your next question comes from Miranda Anthistle with Global News. Please go ahead.
Hi, Premier.
Hi, Miranda.
We've been saying for days, and we've heard from my colleagues on this phone call, that we've observed long lineups at the different test centers.
Yep.
So I want to read you a first-hand account from a woman who has actually experienced it. Her name is Chelsea, and she waited 7 hours at Michael Garrett Hospital in Toronto for a test. And she says, I am fortunate that I am not working and could take 7 hours out of my day to wait in line, that I'm physically able to wait in line and able to go 7 hours without using the washroom. I saw many people who are not as fortunate as I. There are many parents with small children, and there were many older people who struggled with standing for so long without seats. I beg you to please begin immediately to change the way we are doing testing in the city. It is so important that people not be deterred from getting tested in the future. My experience today is unacceptable in a modern city like Toronto. So, Premier, we've heard about pop-ups and about testing to address the lineup. But, the fact is there are people who are waiting for hours in line, like Chelsea, just to go and get tested. So my question to you is, what do you have to say to people like Chelsea, and why wasn't the government prepared for the second wave testing demand?
Well, first of all, I'm sorry that Chelsea had to wait in line, and it's unacceptable. But I go back, and I believe in solutions, not excuses, and facts. The fact is, Health Canada has been sitting on their hands. It's very simple. I've been up here for months. It's a game changer if we can get these antigen approvals and saliva test approvals. It's an absolute game changer. So as soon as we can get that, we can even ramp up more testing centers, and we're ramping up the shoppers. But We are ready. And I want to repeat, we are leading Canada per capita. Not just leading Canada with numbers, but per capita, we're hammering the tests. We were up to 35,000, I believe, today. We're over 30,000 every single day. We're ramping up to do 50,000 tests a day, and then we're going to exceed 50,000, up to 70, 80,000 tests. So it's all hands on deck, but I feel like I'm so frustrated, like I'm handcuffed here because Health Canada just doesn't seem like there's any urgency. And I will mention Chelsea Story to again, the Deputy Prime Minister that's been a great partner. I consider her a friend, but something, guys, we got to get our act together up there. It's very simple. I'll be out here every single day until we start getting answers from Health Canada. Not, as I say, crickets. There's silence right now. Talk about frustration. At least we're up here dealing with it every single day and giving results and showing what we're doing to improve testing. But it's like fighting with one hand tied behind your back. It's frustrating, to say the least. So Health Canada, for the 50th time, give me an answer, and then we can move from. If you're telling me it's not going to be tested, approved for the next 2 months, at least we have a plan to move forward. But that was part of our plan. Never in a million years would I think it would take months to get a saliva test. It's amazing how other areas around the world can get this done, but Health Canada just can't get it done. Like, man, I know the old CEO went out the door and the new one's in. Well, my friend, you got a big job. Let's start seeing results.
Next question.
Your next question comes from James Bowler with Your TV Muskoka. Please go ahead.
Hi, James.
Hi, Premier. So you've chosen Huntsville out of the 60 locations that are going to be set up. I'm just curious, why specifically Huntsville? Because 60 isn't a lot for the entire province. And will we see any more in Muskoka? Because this is a really big place.
It is, and I'm glad you asked me that, because the North, I always do these announcements in the 416-905. But the North is important. Southwestern Ontario is important. Eastern Ontario is important. The world doesn't revolve around Toronto. I love Toronto. I'm a resident of Toronto. But the world doesn't revolve around Toronto. I got to get up into the North, into all sorts of regions that I've been doing. I've been traveling across the province making announcements. But I think everyone needs to see a little love. And I'll tell you, they, as Natalie mentioned, we have the testing in Bracebridge. Well, the people of Muskoka, right across this region in Huntsville, then north of Huntsville, that drive into Huntsville, at least they'll have an opportunity to have testing. So that's the reason we're here. Not to mention, full disclosure, I love Huntsville. But that's not the number one reason. The reason is we're up here telling the people of the North we're here for you.
Follow up?
Yes. So in terms of, staffing and PPE and things like that, I mean, we're going to have tons of people coming in here. We've been to the assessment center just down the street. It's a packed lineup. So are we going to see more money coming in to help with staffing and even possibly pandemic pay? Because now these employees could be put in a situation where they're with people with symptoms that are still coming in to get tested.
Well, I can't talk for the private sector, but we have plenty of PPE. We have dozens of companies making the surgical masks. We have the N95 masks being produced here. We have the face shields, the gowns. So we have plenty of PPE to supply the province and also supply the rest of the country need be. And I talked to the other premiers, asked any of them if they need any support with PPE. They're all fine. But PPE is not the issue right now. The antigen, the saliva test is the issue, the single number one issue with testing.
Last question.
Your final question comes from Lorenda Redekop with CBC. Please go ahead.
Hi, Lorenda.
Hi there. Question, first of all, about this pharmacy testing. It started in Alberta. That was months ago. Why has it taken so long to come to Ontario? And I'm also just wondering if you could give a clearer answer in terms of how many tests you think that this will look after.
Well, good question. But again, if we're going to start comparing provinces, we're kicking Alberta's butt. Simple. And I love Jason. He's a pal of mine. But since you're comparing it, we're way ahead of Alberta, we're way ahead of BC and Quebec and everywhere else. We're doing a great job. But we even have to take it to the next level on top of that. And as for the numbers, once we see how many numbers go through on Friday for the 60 stores, we'll have a better idea as we open up more stores what the load's going to be taken off the system. Now, keep in mind, we're extending hours at the testing assessment centers. We have 10 pop-up units. We have the community paramedics, and I love the paramedics. They're doing a great job. That pulled up mobile units, and we're engaging them to do it right across the province. So and then we have the pharmacies. So it's all hands on deck right now. And we do realize, I've been up here for months, telling everyone to go get a test, no matter if you have symptoms or not. But it's very, very important. The people with symptoms go to the testing center, and people that are asymptomatic, a little anxious, then you come to a local pharmacy. And we'll have these numbers climbing again.
Follow-up?
For a follow-up, in addition to the huge lineups that we keep seeing every day for testing, we're also seeing a growing backlog in processing. And the Ontario Hospital Association has said that its labs can't keep up. So what are you looking to do? And then in terms of these pharmacy tests, where will those be processed?
So before I pass it to the Minister of Health, the same situation. We're reaching out to the private sector, which the private sector is helping out with the testing. We're buying more equipment to be able to do the testings within the hospitals across the province. And again, it's all hands on deck. I'm talking to pharmaceutical companies to see if they have any additional lab technicians, and we can train them up. We're reaching out to the universities and be it colleges for their lab capacity, and getting the students that are in their last year to go, and we can really do express training with the students until they'll be up and going. So it's everyone, all hands on deck right across the province. Everyone's doing a great job, and I'll pass it over to the Minister. Thank you.
Well, I think the Premier has outlined it very clearly, but you're absolutely right. There's the two aspects to testing. There's the specimen collection with the swabs or the saliva tests, but they still have to go to a lab to be processed. And so it's one thing to get a test in a timely manner, but you also want the results in a timely manner. So we have to make sure that as we increase in the testing with the specimen collection side, we also have to increase on the lab side. So as the Premier indicated, we are working with the private sector, with community labs, but we're also working with hospitals and universities with any spare capacity that they have, that they can help us in processing these swabs so that we don't end up being held far behind. And I know in Northern Ontario, far Northern Ontario, that there are situations where the specimens need to be flown to places where the labs are. We're looking at developing a separate capacity system, both to have some of the units there, the lab capacity units in places like Thunder Bay and Sioux Lookout and other places, but we also want to make sure that for any of the swabs that have to be flown somewhere, that we have a direct system for doing that, so we don't have several days delay in getting the swabs from one place to where they can be examined. So we're moving forward with a number of ways and means to increase our lab testing capacity as well as the timeliness of the testing.
Thank you.
That's great. Thank you so much, folks. Thank you.